Hello, everybody. Welcome to the Healthy Joints, Healthy Lifestyle Show. And I have a special guest today. For those who don't know me, my name is Dr. Dada, and I've been a rheumatologist for the last 20 years in the greater Seattle area. Today, I am going to introduce to you Dr. Justin Putz, who is a rheumatologist that has joined our clinic in the greater Seattle area. Welcome, Dr. Putz. We are so excited to have you join Overlake Arthritis and Osteoporosis Center. And we would like to know a little bit about you. I know, obviously, I know a lot about you already, but I want to share with our audience, know that you have had a passion for rheumatologists for years. And we met when you were kind of doing a rotation through our clinic. So if you wouldn't mind, tell our listeners a little bit about your background, and then we'll do a deep dive into why rheumatology. Welcome.
Oh, thank you. I'm very excited to be here. I was originally from the Midwest, born and raised in Iowa, and then landed out here as an adult in the Seattle area. And then did my training here in Washington, a little bit back in Iowa, and just completed my fellowship in San Diego. So I'm very excited to be circling back to the Seattle area, which I consider home, and very excited to be joining Overlake Arthritis and Osteoporosis Center.
Okay, wow. Well, we are so happy to have you. We've been in the office for a week now, and it has been amazing. So, tell us a little bit about what inspired you to become a rheumatologist.
The biggest reason I love rheumatology is that because we're able to have such a positive impact on patients' lives in a relatively short period of time. We can decrease pain, improve quality of life, improve function, and those things are all really important to living a good life and being happy. And I find that very rewarding.
You know, that is so true. And I think that definitely resonates, I would say, with most rheumatologists. Just the fact that, in rheumatology, we can really improve people's quality of life. The other thing that is very interesting about your background that we haven't spoken about is that you bring also a military experience. Even before you started medicine, you served in the army?
Correct. Yes, I was a combat medic.
No. So how did that's, and I full kudos to you, right? So how did that experience kind of shape the way you care for patients today, would you say? Does it have any impact at all?
I think it definitely does. Military service is very unique. It has a way of bringing people together. I think almost everybody knows someone who is a veteran, whether it's a family member or a friend, and that's really allowed me to connect with patients in a memorable way. And that's allowed me to provide better patient care.
Yeah. Do you think that there's, lessons? I mean, I can already think of the bat of, what being in the military and having that background, how it influences like one's clinical approach, perhaps.
As Yeah, so as you might imagine, the military, it's very detail oriented. Being able to focus on all the small details is how you're successful. And I think rheumatology is the same way. In order to find the right diagnosis, the right treatment, you have to focus on those details. So it's very important to be a good listener and being able to connect with patients and focus on those details to make sure we're doing the right thing.
Fantastic. Yeah, I mean, I'm really excited to have the opportunity to work with you now that you're all grown, and because I met you when you were doing a rheumatology rotation. I think one of the things that I think still has been consistent every time I've met you is just that the attention to detail, and honestly, you also the compassion that you've always had. So I think that's something that our patients are really going to notice is that you're just a very caring person. And I always say that love is action, and in that compassion and caring for people and being detail oriented is how we don't miss things with people. So yeah, I really think that is going to be, I think, for you, be an addition for you based on who you are. So let's get down to rheumatology. So are there particular areas in rheumatology that you feel like you're especially like passionate about?
Yes, so I really do love all of rheumatology. Our diseases are really interesting and unique, and not a lot of other physicians outside of rheumatology really understand them. And I think that's one of the best things about rheumatology is that we can be that expert. So diseases that we commonly treat, like rheumatoid arthritis, psoriatic arthritis, gout, they're very rewarding just because we have so many treatment options now that we can really get patients feeling better fairly quickly, like I mentioned. But I'm also very passionate about the less common diseases we treat, like lupus, inflammatory muscle disease, vasculitis. They can be very scary diagnoses, and being able to help patients navigate those illnesses successfully is really important to me.
No, while we're talking about that, can you give us an example of a patient that's had a really um, severe, well, no, let's rephrase that. A patient who had a really good outcome after being in your care. Are there any examples that you may have for us?
Yes, so I think lupus is one of those cases. Not too long ago, I had a patient in her mid 20s. She had very, very severe lupus where it was affecting her lungs, her kidneys, her brain. She was having seizures, and it was a very scary time. She was newly married just maybe 3 years before that and wanted to start a family and have kids. And she showed up at the hospital, in the ICU, very, very sick. And we were able to work with her and the family, start on treatment, very aggressive treatment with IV medications like chemotherapy agents and plasmapheresis to really help get her disease under control. And then, fast forwarding after that, I saw her in the clinic for 3 or 4 months afterwards, and she was doing much better. Her disease was much better under control, not perfect, but we had a plan going forward for 3 months, for 6 months, for 12 months, what we were going to do and what our goals were. And I think that really set the stage and expectations for her and her husband, and made the disease that's very complex in many ways seem much more manageable and approachable.
That is such a warm and very practical experience that some of our uh, patients with severe conditions, especially lupus, right? So it sounds like she was really, really sick, newlywed, and had to go through this. But you're right, I really kind of um feel like the patient really appreciates the fact that they have somebody to walk them through this difficult time and is able to, exactly what you said, is able to kind of take something that could be otherwise complex and scary and break it down into small, manageable bits and continue to feel that they have the support. And I love the way you said that there was a plan going, months, month after month after month into years where they could kind of see the future and find the path. And so having that, especially when we're dealing with a lot of these autoimmune conditions, really, really resonates with our patients. And I think that's one of the things that makes you really an amazing rheumatologist because you can see that. And even when the patient is only thinking about tomorrow, the next day, you're able to help them, hey, this is what the future looks like, and this is how we will help you to get to that excellent quality of life that we crave for our patients. I think that was a very good example. Um, so let me ask, because what's happening now in the clinic is that we're going to have a lot of patients coming to see you. Can you tell me what patients can expect when they come to see you? How you kind of describe your philosophy or style?
I think it's important for patients to know that I'm their health advocate, that I'll sit down and listen, take as much time as it takes to make sure that collaboratively we understand what's going on, what the diagnosis is or how we're going to get there, how that affects your life, make sure we have the right diagnosis and work together to come up with a treatment plan to make sure that both the patient and the rest of the healthcare team understands every step along the way, and that if there are any questions or any concerns, I'll be here to help with each step.
Yeah. So that would definitely resonate with our patients is, they want to have a partner who's going to take the time to listen and help them. And even if there's not an immediate answer, is exactly what you're saying is you're going to continue to work with them to find the right diagnosis. I don't think anyone could ask for more. So, how do you find, because I think one of the things that people get concerned about is, whether their providers or physicians would be able to, how they collaborate. Any thoughts about your role in kind of a collaborative approach at Overlake Arthritis?
So I think healthcare is very complex, and it's becoming more complex. Every year there's a lot of moving parts, and I think as your rheumatologist, it's my job to really spearhead that healthcare for you, make sure that everything is working the way it should, um, leading the team, working collaboration with the rest of your healthcare team, your primary care, and everyone in between, whether it's insurance, whether it's other specialists, whether it's the hospital, whatever you need to be able to really come together and make sure everyone's on the same page, have the same plan, and taking care of you.
What excites you the most about that?
I think the most exciting thing is that healthcare is kind of mysterious to a lot of people. Unless you're really in healthcare, you don't understand all the working, and it can be very sort of tedious or very overwhelming. But I think being able to help patients through that and sort of remove that shroud of mystery and be the expert that knows how to get through the system and work it in a way that is advantageous to the patients is very rewarding.
Makes sense. So having an advocate, I love the fact that you mentioned that, and I think that the patients also need to know that that's kind of how you see your role is as an advocate for the patient. But I'm going to piggyback on something you said about confusion. So you're right, there's confusion in healthcare, but there's also confusion in just in like rheumatology conditions, or somebody says they have a positive ENA, and Google is always out there, and you put in the positive ENA and you see all kinds of horrible, scary things. And so rheumatologic conditions can be very confusing using that word. How would you help patients understand kind of what's going on, and how do you help them to feel more in control?
I I love that patients are able to take control of their health and be able to have all of these resources to be able to do that research. It's always helpful when patients are really motivated to understand what's going on. And so I encourage patients to look up, information about their diseases and treatments and options. But I encourage patients to do it in a sort of healthy way. So make sure you're using good resources, things like the Arthritis Foundation website and the ACR website, the American College of Rheumatology. They have great resource options. And then the most important thing is that if there is any confusion or lack of clarity, to make sure you bring those questions up with me so that we can talk through them together so that we're on the same page and that you have the best information that's readily available and that's accurate.
Okay, makes sense. Yeah. So, a couple more thoughts I was, when we think about our approach to patients, if you had a superpower, like a superhero power, what power would you want to have that would make a difference in the lives of our patients?
That's tricky. I think being able to see the future would be probably the best thing from a rheumatology standpoint, because there's so many times where we have some positive labs and some non-specific symptoms, and we're not sure what to make of it. Sometimes we call it undifferentiated connective tissue disease, or there could be something brewing that may or may not in the future develop into something, and we're just not sure. And other times, some of our testing just takes a long time. It can take many weeks or months, depending on what's going on to be able to come up with the diagnosis. And so having the ability to see the future, I think, would be very, very helpful and to know where patients are going and what's going to develop so we can get ahead of it.
Okay. So one advice I have for patients that are going to come with Dr. Putz is you need to bring your crystal ball. Okay, so outside of our clinic, tell us, what are your interests? What do you do in your free time, Dr. Putz?
So when I moved to the Seattle region, all the way back in 2007, I absolutely fell in love with it. I grew up in the scouting program. I was an Eagle Scout, and I did a lot of hiking and camping and outdoorsmanship in the Midwest. And I bring that with me along here to the Seattle region. I love everything outdoors: hiking, camping, skiing, cycling, boating, anything I can get outdoors. Rain or shine, I love being outside. And I have a couple of dogs I love taking with me when going out and doing those things. And so I try to be as active as possible.
Fantastic. Well, so thank you, Dr. Putz, for taking this time to really just kind of go through your intro to our patients in the community, letting them know that, hey, you are available. And so if you're listening and you are in the greater Seattle area, do make an appointment at PSR at Overlake Arthritis. Thank you so much, Dr. Putz, for coming on the show. We also want patients to know that we have a phone number. You can call us at 425-453-0766, and you can ask for an appointment with Dr. Putz, and you can pretty much get in, I would say, at least within a month. His schedule is getting pretty filled up, but I would say at this time of this recording, I know that Dr. Putz has an appointment at least available for a month from now. So do get on the appointment, and you will, I'm sure, benefit from his knowledge and wisdom and expertise. Thank you so much, Dr. Putz.
Thank you very much.
Okay, you take care. Thank you, everybody. Oh, by the way, like this video, subscribe, and share it. I'll talk to you soon. Bye, everybody.